Hello, and welcome to our educational video, Lupus and Tapering Steroids. I'm Annika Hazlitt, a member of the Board of Directors at Kaleidoscope Fighting Lupus, and your host. Corticosteroids like prednisone can be life-changing, even life-saving for those living with lupus. Yet they carry serious side effects and can disrupt your quality of life. So, how to balance the good with the bad? Today, we are fortunate to hear from Dr. Sharon Dowell, a practicing rheumatologist and professor at Howard University Hospital. She is truly committed to helping those living with lupus, and in this video, she discusses how steroids function, their therapeutic and harmful effects, and how she approaches tapering their use. But before we hear from Dr. Dowell, we'd like to thank our presenting sponsor, AstraZeneca, for their generous support in making this event possible. We also thank our community sponsors, Left Coast Lupus, 7 Minute Cinemas, and Blue Eyed Crow Studio. Please note that this video is for informational purposes only and is not meant to replace the advice from your physician. Now, let's hear from Dr. Dowell.
Thank you for that introduction. Today, I want to spend a little time talking about prednisone and the importance of tapering prednisone. Now, before we start, I just want to let you know that I may be using the term steroid, corticosteroid, glucocorticoid, prednisone, and prednisolone a little bit interchangeably, but pretty much I'm referring to steroids. Now, those of you who have lupus may have been on steroids in the past, and you know that it forms a major part of our treatment algorithm, especially when we're treating people who have severe disease. These are conditions where lupus are either causing significant inflammation in an organ like the kidney, which can threaten that organ. In other words, it can lead to damage to the kidney, or when there's a threat to your life. So we use steroids particularly when patients have severe lupus. And we have a bit of a love-hate relationship with it. So steroids are great because they work quickly and they're effective. And so they really get inflammation down to a very low level very quickly. The benefit of that is that you feel better and you do better. And the other benefit is that by getting rid of the inflammation quickly, we prevent the damage that can occur to the organ that has been threatened by the lupus or the lupus flare. But prednisone over a long time has many consequences. We call them adverse effects. And I'll talk about some of these a little bit later, but I want you to know that ultimately, the reason why we use steroids is that it gives us time. So it buys time for you to get started on medications, which are as effective, but just work a little bit more slowly than prednisone does. So steroids are often referred to as a bridging therapy. It is a bridge between when you have severe symptoms and when we start other medications, which you will likely continue on afterwards. What happens with a bridge? When you get onto a bridge, at some point in time, you travel across it and you get off of the bridge. So with steroids, there should be an exit point where you're no longer on that medication. You may ask the question why, if prednisone is so effective and works so well, why should you stop it? Well, that's because long-term therapy with prednisone has several bad effects. And they can be as simple as from increased fragility of your skin to stretch marks in the skin and easy bruising to muscle weakness. It can also cause bone loss, which can be severe enough that some people can have fractures, which then leads to difficulty walking and difficulty functioning. It can also lead to weight gain, and who wants that? especially weight gain around the tummy, or they call it central adiposity. It can lead to high blood sugars. It can cause high blood pressure. And if you take the last three together, the weight gain, the high blood sugars, which can actually lead on to diabetes mellitus, and the high blood pressures, together, these three can increase your risk for heart disease, and they can put you at increased risk of having heart attacks or of having a stroke. Additionally, it can also affect the eyes. You can have early cataracts leading to decreased vision and a need for surgery. And it can cause high eye pressures or glaucoma, which, if it isn't treated early, can actually be a blinding condition. And in addition to all of this, prednisone can increase your risk for infection. And these infections can sometimes be fatal. So it does have several good effects, but if you're on it for a very long time, it has several bad effects that we would like to avoid. So to prevent long-term damage due to all of the conditions I mentioned above, we know that we need to stop prednisone. But it's interesting, when people are on prednisone for more than 2 to 3 weeks, it actually changes the body's own production of its own intrinsic or endogenous steroid, which we need for our own survival, and that's called cortisol. So the medical term is that prednisone suppresses the hypothalamic pituitary adrenal axis. And basically, that axis is responsible for the production of cortisol, which pretty much keeps the body going. When the body senses that there is prednisone present or enough steroids present in the body, it turns off that engine. So cortisol is no longer produced. So when you stop the prednisone, when you suddenly take it away from the body now neither has its own cortisol or the one that it was taken from outside. And without this, the body can go into failure. Now, most people who stop prednisone may not go into a severe crisis, but they can have symptoms. And these symptoms can include severe fatigue and tiredness and lassitude. So it's really important to avoid this abrupt cessation or this really quick stop of prednisone. We have to give the body's own adrenal glands, the body's own engine, time to recognize, oh wow, the prednisone that I was getting, or the steroid that I was getting from outside is slowly decreasing. I need to ramp up my own production. And that is the reason why we generally do a steroid taper. It's to give the body time to begin to produce its own cortisol again, so that you don't go into a crisis from a sudden lack of any steroid at all. And that's because you need a little bit of cortisol around to keep all of your body's functions going. This risk is highest in people who have been on steroids for more than 2 to 3 weeks. If you've only been on steroids for 2 weeks, we tend not to do the taper. But if you've been on it for more than 2 weeks or 14 days, then we tend to begin a steroid taper. Another question that people often ask is, well, do we need to taper the steroid completely? Like, how much steroid is dangerous? Is a low dose safe? So is even a small dose of steroids bad? Because there are some of you who are probably right now thinking about your own medications and are realizing that you are still taking a relatively small dose of steroid and you've been on it for some time. I will tell you that our ultimate goal is, if possible, to stop steroids completely over time. And that means that if possible, we try our very best to taper or to slowly decrease that dose of steroid until you're taking none at all. And that's because we do have studies, we do have information that shows that even a dose as low as 2.5 to 5 milligrams per day can affect bone and bone loss. And so we know that even small doses can have some harm associated with them. So our main aim is to decrease it until you're on no steroid at all. But sometimes we have to compromise because there are some people who have lupus conditions that are difficult to treat or who have lupus conditions which flare often, who may require a small dose of prednisone. In that case, we do our absolute best to reach the lowest possible dose. And ultimately, our aim is to get you to a dose of 5 milligrams or less. Now, some studies have shown that when we decrease or when we withdraw prednisone therapy, there can be a slight chance of increased flares of lupus. Luckily, in most of those studies, the lupus flares tended to be mild with no severe consequences. But again, I want to stress that there are some of you who may require a small dose of prednisone ongoing. And so it is important that we tailor the steroid taper to the individual. And there may be some trial and error in how this is done. Now, are there rules for tapering steroids? I would say that there is some general guidance. So most doctors will aim to maybe taper by 10 milligrams when you're on doses above 40. And then maybe they'll taper by 5 milligrams every 2 to 4 weeks when your dose is above 20. And then they'll taper by maybe 2.5 milligrams every 2 to 4 weeks. And then gradually they'll taper by about 1 milligram. So we do a very gradual taper over time. But ultimately, the way the steroid is tapered will be individualized to you, to your condition, and to how you're feeling and how you do with every incremental decrease in the dose of steroid. One of the main guidances from the European League Against Rheumatism in their 2019 update on the management of systemic lupus was this mandate, really, this real stress on asking physicians that when patients require long-term therapy with prednisone, to do their utmost best to get them to a dose of less than 7.5 milligrams, and really to the lowest possible dose that we can. But there are some things that can hinder the steroid taper or can hinder our ability to get to this very low dose. I mean, one of those things would be if your condition flares. And if your condition flares, note that we may increase the steroid dose again, but it may also signify that the additional medication we're using to treat your lupus needs to be optimized. Maybe we need to change that medication, or maybe we need to increase the dose of that medication so that we can, in the future, get your steroid dose lower. Another real issue with the steroid taper is that I think people who've been on it for a long time and who equate it with a sense of well-being become sort of psychologically dependent on it, so that when the dose is tapered, they just don't feel well. That's a little bit harder and a little bit trickier to work through. I would say that if your dose of steroid is tapered, be aware that this can occur, that you can feel a little bit more tired, a little bit more achy, and some of this may just be your own sort of connection to taking this medication over a long time. Of course, when you're not feeling well, you need to see your doctor to make sure that there is no evidence of a lupus flare. And additionally, that there's no evidence that, say, your adrenal glands are not producing enough of your own intrinsic cortisol. Once those things have been checked and they're okay, then it may be that we just have to rough out this period of this transition time as our dose is gradually decreased. Ultimately, I think it's important that anyone who has lupus understands a few things about prednisone. They understand the importance of how quickly it works, that it's effective, and understands why we therefore use it in situations when you have severe symptoms of your disease. Now, they understand that if you're on it for a very long time, it can have several bad effects, and therefore understand why we, as your doctor, want to take you off of steroids eventually. Understand that while you're on steroid, your body's own adrenal gland is not creating the necessary intrinsic endogenous cortisol that you need to function. And therefore, if we do plan to stop it, we have to gradually reduce the dose or taper it, and that this takes time. And lastly, understand that when you've been on it for a long time, your body may become very attached to it, and that tapering can be a little bit difficult. And it's a time when you need to be monitored closely by your doctor, and that you'll need to check in with your doctor to have your labs done to make sure that there is no flare occurring or no signs that your adrenal glands aren't doing the job that they're supposed to, so that that can take you safely through that period of time. Again, I want to thank Kaleidoscope Fighting Lupus for doing their utmost best to keep patients who have lupus and relatives and families of those who have lupus well informed so that they can live their best lives. Thank you.
Thank you for that great information, Dr. Dowell. This brings us to the end of our educational video, Lupus and Tapering Steroids. Again, we thank our presenting sponsor, AstraZeneca, for their generous support in making this program possible, as well as the support of our community partners, Left Coast Lupus, 7 Minute Cinemas, and Blue Eyed Crow Studio. And we especially thank you for watching. We encourage you to visit our website, kaleidoscopefightinglupus.org, and follow our social media platforms for the latest lupus news, program information, award-winning blog articles, and so much more. Thanks for spending time with us. And remember, you are not alone. I'm Annika Hazlitt for Kaleidoscope Fighting Lupus. Please take care.